And very often we are seeing Parkinson's patients for speech and swallowing. But I think that given this prevalence data, 75% of cognitive impairments, we need to really pay attention to cognitive and language issues in this population, because whatever their cognitive strengths and weaknesses are at the time that we see them is going to strongly affect the success of any intervention strategy we choose for swallowing or for speech as well. If we're working with ALS patients, we're very often working on some sort of communication system, AAC, and speech and swallowing issues, and there need to be strategies and so forth. And so if there are impairments of executive function and memory, this is going to seriously impact the patient's ability to use any kind of complicated communication system or strategies or whatever it is. So we really need to know about the level of cognitive impairments in those patients. Another example is multiple sclerosis, and again, it's roughly about half of MS patients have some form of cognitive impairment, and again, it's primarily executive function and memory impairment. So the same issues apply here when we're dealing with issues of speech and swallowing, which are also so important. But those intervention strategies that we use if we want the patient to do some sort of manipulation or strategy of any kind is going to be, we need to choose it wisely if the patient is also having some sort of executive and or memory impairment. On the left of this screen, you will see the number of cases that were identified for each of the impairments listed based on the typical clinical observations. So in other words, they looked in the medical chart and they said, okay, based on the medical chart, which of these were identified? On the right-hand side of the screen, what you're looking at is the number of cases that were identified in the same domains when the researchers administered the formal cognitive assessment. So you can see that based on typical clinical observation, only one patient was identified as experiencing anomia. However, when a formal cognitive assessment was administered, 34 patients were identified with anomia. Another striking difference, actually all of these are very striking, is in hearing impairment, which was part of this screening because it does impact significantly on functional abilities and ability to function, first of all in the medical environment, but then also independently. 3 patients were identified with hearing impairment just based on clinical observation alone, informal observation. 22 patients were identified with hearing impairment when a formal assessment was given.